7 strange signs your body is begging for vitamin B12. Have you ever had random numbness in your hands or feet, mood swings, or even a swollen tongue and wondered, what's going on? Weird, right? Vitamin B12 is a crucial nutrient that keeps your brain, nerves, cell growth, and energy levels running smoothly. But what happens when you don't have enough of it? Well, that's where things get interesting. When vitamin B12 levels drop, your body sends out some unexpected distress signals. We often associate vitamins with general well-being, but a vitamin B12 deficiency can manifest in some surprising ways. Let's dive into 7 strange signs that might mean you're running low. Quick reminder, we are not doctors. This video is for information purposes only. If you are experiencing a medical condition, don't hesitate to speak with your doctor. Let's kick things off with a symptom that might make you think you're having a weird episode. Number 1, tingling and numbness, particularly in your hands and feet. Have you ever feel like your hands or feet are falling asleep way too often? That strange pins and needles sensation, or even a complete lack of feeling, could be more than just bad circulation. It's a classic sign of B12 deficiency. Vitamin B12 plays a key role in maintaining a healthy nervous system. It helps produce myelin, the protective coating around your nerves. Without enough B12, your nerves start to malfunction, leading to tingling, numbness, and even burning sensations. When you're low on B12, your nerves can't send signals effectively, leading to those strange sensations. The longer this deficiency goes untreated, the worse it can get. Some people report feeling an electric shock-like sensation in their limbs, while others may notice clumsiness or trouble with coordination. In severe cases, it can make simple tasks like buttoning a shirt or holding objects difficult. Over time, untreated B12 deficiency can cause permanent nerve damage. This can make it difficult to walk or maintain balance. Before we move on, don't forget to hit the like button, subscribe for more health tips, and share this video with someone who needs to hear this. All right, moving on. Number 2, fatigue and weakness. We live in a world that glorifies the hustle and often equates being busy with being productive. But here's the thing. Constant fatigue isn't normal, and it's definitely not something you should just accept as part of your daily life. If you find yourself feeling constantly drained, like you could sleep for a week straight and still wake up tired, your body might be trying to tell you something. Here's why. B12 is essential for making red blood cells, which carry oxygen throughout your body. When you don't have enough of it, your cells don't get the oxygen they need, leaving you feeling drained, sluggish, and weak. This kind of fatigue doesn't go away with caffeine or rest. You may find yourself needing naps throughout the day, struggling to complete simple tasks, or feeling too tired to engage in activities you once enjoyed. Over time, chronic fatigue due to B12 deficiency can contribute to muscle weakness. This makes it harder to lift objects, exercise, or even stand for long periods. Now, when you're low on B12, your body can't produce enough healthy red blood cells. This means less oxygen is delivered to your cells, leading to that all-too-familiar feeling of fatigue and weakness. You're essentially running on fumes, and your body is trying to get your attention. It's often a sign that something is off balance. I know, life can be exhausting, but there's a difference between feeling tired after a long day and experiencing chronic, unexplained fatigue. We're talking about the kind of fatigue that makes it difficult to get out of bed in the morning, the kind that saps your energy even after a good night's sleep. If your fatigue is persistent, interfering with your daily life, and accompanied by other symptoms like weakness and shortness of breath, don't ignore it. Next, number 3, pale or yellow skin. Now this next one can be a little alarming if you don't know what to look for. Changes in your skin color. Has anyone been telling you that you look a little pale or even yellowish? It's not just bad lighting. This could be a sign of vitamin B12 deficiency. Specifically, you might notice your skin looking paler than usual or even taking on a slightly yellowish tint. Here's the thing. A lack of B12 can lead to anemia, meaning your body isn't producing enough healthy red blood cells which carry oxygen throughout your body. As a result, your skin may appear pale. Let me explain. B12 is crucial in making red blood cells, which carry oxygen throughout your body. Without enough B12, your body can't produce enough healthy red blood cells, leading to anemia. And one of the telltale signs of anemia is pale skin. This happens because the red blood cells contribute to your skin's natural color, and fewer of them mean less color overall. Let's move on to that yellowish tint. This is less common but can happen in severe B12 deficiency. In some cases, this B12 deficiency can also cause a condition called jaundice. This is where a buildup of bilirubin, a yellow pigment, occurs in the body, where your skin and the whites of your eyes take on a yellowish tint due to an excess of bilirubin in your bloodstream. Some people also experience dark under-eye circles, giving them a sickly or worn-out appearance. This happens because B12 plays a role in the breakdown of bilirubin, and a deficiency can disrupt this process. Now I know what you're thinking. Should you be running to the doctor every time your skin tone changes slightly? Of course not. We're talking about noticeable, persistent changes here, not just a temporary pallor after a long day indoors. The key is to pay attention to your body and notice any significant changes or patterns. Addressing a B12 deficiency early on can help prevent more serious complications down the line. Next, on our list of strange signs your body is begging for vitamin B12, number 4, mood changes and depression. Are you feeling unusually down, anxious, or even irritable? Your mood swings might not just be stress-related. B12 could be the missing piece of the puzzle. Here's the thing. Vitamin B12 is essential for producing neurotransmitters like serotonin and dopamine, which regulate mood. B12 plays a crucial role in brain health, and a deficiency can manifest in some surprising ways. Low levels of B12 have been linked to depression, anxiety, and even mood disorders. Some studies suggest that people with depression who supplement with B12 may see improvements in their symptoms. And get this, in addition to depression, low B12 levels can also lead to increased feelings of stress, panic attacks, or excessive irritability. Some people experience emotional numbness, feeling disconnected from their surroundings or unable to enjoy things they once loved. Vitamin B12 helps maintain the myelin sheath, a protective covering around nerve fibers. These nerve fibers ensure smooth and efficient communication between brain cells. When B12 levels drop, this communication can get disrupted, leading to a range of neurological and psychological symptoms. One of the most common mood-related symptoms of B12 deficiency is increased irritability. You might find yourself snapping at loved ones or feeling easily frustrated. This can be incredibly frustrating, both for you and those around you. Beyond irritability, some people experience more pronounced mood swings, going from feeling okay one moment to feeling down or anxious the next. In more severe cases, B12 deficiency has even been linked to depression. This is because B12 is involved in the production of neurotransmitters like serotonin and dopamine, which play a crucial role in regulating mood. Now, I understand that attributing mood changes solely to a vitamin deficiency might seem like a stretch. After all, mood is complex and influenced by countless factors. But the connection between B12 and mental well-being is well established in the medical community. If you've been feeling increasingly irritable, experiencing mood swings, or struggling with symptoms of depression, and especially if these symptoms have emerged alongside other signs of B12 deficiency, it's crucial to consult with a healthcare professional. Early intervention and proper management can make a world of difference. If left untreated, long-term B12 deficiency can contribute to more serious mental health issues, including paranoia or hallucinations. Next, number 5, difficulty concentrating and mental impairment. This is another important area where B12 deficiency can rear its ugly head, your brain power. Have you ever walked into a room and forget why you're there? Or struggle to remember things that used to come easily? Brain fog and memory issues are major warning signs of B12 deficiency. Those everyday mental tasks like focusing, remembering things, and thinking clearly. Your brain depends on B12 to function properly. Without it, cognitive processes slow down, making it harder to focus, remember details, or think clearly. In severe cases, long-term B12 deficiency can even increase the risk of dementia or Alzheimer's disease. People with low B12 often describe their brains as feeling foggy or slow. They may have trouble multitasking, processing information, or following conversations. Some experience difficulty in making decisions, while others struggle with simple mental calculations or recalling names and faces. If you're finding those more challenging than usual, a lack of B12 might be a contributing factor. We've already established that vitamin B12 is essential for healthy brain function. This is particularly important for maintaining those crucial myelin sheaths that protect nerve fibers. When these sheaths are compromised due to a B12 deficiency, the communication between brain cells can become sluggish, leading to cognitive difficulties. You might experience brain fog, that frustrating feeling of being mentally fuzzy and unable to think straight. This can manifest as difficulty concentrating on tasks, struggling to follow conversations, or feeling easily distracted. In addition to brain fog, some individuals with B12 deficiency report memory problems. They might misplace items more frequently or struggle to recall recent events. These cognitive symptoms might seem minor initially. It's essential not to ignore them. In many cases, these types of cognitive symptoms are reversible with B12 supplementation. By replenishing your B12 levels, you can support healthy brain function and potentially reverse some of the cognitive decline associated with the deficiency. Next, number 6, pain and inflammation of the mouth and tongue. All right, let's talk about something you might not expect. Your mouth, specifically your tongue. We're talking about inflammation of the tongue, otherwise called glossitis. And trust me, it's not pleasant. You might notice your tongue becoming swollen, tender, and even changing color. Your tongue can reveal a lot about your health, and when it comes to B12 deficiency, it might be one of the first places to show symptoms. A sore, swollen, or inflamed tongue, also known as glossitis, is a clear sign of low B12. It may appear red and smooth with tiny bumps. Some people also experience burning sensations, ulcers, or even a metallic taste in their mouth. That's because the tiny bumps on your tongue that contain your taste buds, called papillae, start to disappear. B12 deficiency can also cause dry mouth, making it harder to swallow and increasing the risk of mouth infections. Some individuals may even notice frequent canker sores or a persistent sore throat. But did you know that recurring mouth ulcers, especially those painful ones that seem to take forever to heal, can also be a sign of vitamin B12 deficiency? These symptoms can make eating uncomfortable and lead to unintended weight loss due to difficulty consuming food. As we've mentioned before, vitamin B12 plays a key role in cell growth and development, including the cells in your tongue. When you don't have enough B12, those cells can't regenerate properly. This can lead to inflammation and those uncomfortable symptoms. So if you're constantly battling these mouth invaders, especially in conjunction with other signs we've discussed, it's time to have a chat with your doctor about your B12 levels. Number 7, irregular heartbeat and headaches. An irregular or rapid heartbeat, also called palpitations, can be another strange yet serious sign of B12 deficiency. You might feel like your heart is racing, fluttering, or skipping a beat. When your red blood cell count is low, your heart has to work harder to pump oxygen throughout your body, leading to irregular heartbeats and shortness of breath. Some people might even experience sudden drops in blood pressure, causing fainting spells or lightheadedness upon standing. Others report tightness in their chest, which can be mistaken for a heart condition. If you're noticing these symptoms along with fatigue and weakness, low B12 might be the culprit. Remember how I mentioned that B12 is involved in red blood cell production? Well, those red blood cells are responsible for carrying oxygen throughout your body, including to your heart. When you're low on B12, your red blood cell count can drop, leading to a condition called megaloblastic anemia. Now, let's talk about the headaches that often gets brushed off. We've all been there: deadlines, traffic, that never-ending to-do list, all triggers for a pounding headache. Here's the thing. The lack of oxygen reaching your brain can lead to dizziness, confusion, and persistent headaches that don't seem to go away. When your B12 levels are low, it can affect the nerves in your head and neck, leading to those frequent nagging headaches. Vitamin B12 deficiency can also cause frequent headaches and migraines. These headaches might be dull and persistent, or they can be sharp and throbbing. Before we wrap up, it's important to remember that vitamin B12 deficiency is more common than you might think. The truth is, it's usually very treatable. So what can you do? If you suspect you might be deficient in B12, talk to your doctor. Incorporating B12-rich foods into your diet is a great place to start. I know life gets busy, and sometimes our diets aren't perfect. This is where supplements come in. A good quality B12 supplement can help bridge the gap and ensure you're meeting your daily requirements. And there you have it, 7 strange signs your body is begging for vitamin B12. Thanks for watching. We hope this video has been informative. If you found it helpful, hit the like button. Please remember to comment, share, and subscribe for more. Until next time, take care of yourself and each other.